I think that just as we're living in a nuclear age, we have grown so tremendously in scientific knowledge. It doesn't seem too much to say that men can begin to awaken to the fact that they haven't grown enough spiritually and haven't recognized their spiritual capacities.
Once something like eating is death, then you've struck at the very heart of life. The enemy of the older radical theories may have been the ruling class, but today the stakes of whether we will reform ourselves into a new kind of human being, a new kind of society, whether we will find selves worth being, the stakes of it are simply life itself.
All right, so today I have Dr. Seth Berkowitz. I think this is a first for this channel as far as having a medical doctor on for an interview, and this is about a pretty important subject, which is equality in healthcare. And I'll just say a few words about Dr. Berkowitz and then ask you to tell us a little bit more. He's an associate professor of medicine and he's section chief for research at the University of North Carolina at Chapel Hill School of Medicine in the Division of General Medicine and Clinical Epidemiology. He's a general internist and primary care doctor, and he studies the relationship between health-related social needs, such as food insecurity, and health outcomes. He is the author of the recent book, which we're going to talk about today, Equal Care, Health Equity, Social Democracy, and the Equalitarian State, or the Egalitarian State. And this was published by Johns Hopkins University Press just this year. It examines how public policy can improve population health. So, first of all, congratulations on this book. Great publisher, too. And it really seems like an important topic for us right now. So first, Dr. Berkowitz, could you tell us a little bit more about yourself and just what motivated you to write this book? Because I imagine a lot of people in your position wouldn't take the time to write a book like this. So tell us what motivated you to do it.
Sure, yeah, and thanks so much for having me on and for the kind words about the book. I really appreciate it. So I'm a primary care doctor. In my clinical work, I do research largely around what you might call social determinants of health topics. And a lot of my career has really been what you might say is sort of, mitigating the consequences of adverse social determinants of health. So I see people in clinic whose health has been harmed by social structures and the ways that we distribute resources unfairly and, not creating opportunities for people. And, we're sort of kind of trying to do the best we can to address those issues once they've occurred. And I think that's, good work. That's what I spend most of my days doing. I have a lot of colleagues who do it. I think it's helpful and beneficial for people. But at the same time, I think it just kind of becomes, increasingly clear that that's not really addressing the problem itself. Again, it's sort of mitigating the consequences, but not sort of preventing people from experiencing this poor health in the first place. And so that, the idea that you weren't addressing the root causes, so to speak, that's not new. I mean, I think that was always understood, but it had always seemed to me, well, sure, that's all you're doing, but the causes of these issues are so complex, you couldn't possibly understand them. It wouldn't really be possible to make a difference. And so I think for the early parts of my career, I kind of just went along with that. And over time, I just got more and more curious about, well, if you did really want to, take population health seriously, take health equity seriously, try to think about what social institutions you would put in place to really promote population health as well as possible. If you really wanted to give it a good normative underpinning and say, this is something that is defensible from a political philosophy perspective and takes people's equality seriously, what would that look like? What would the normative basis of that be? What would the actual, institutions that we put in place in the real world and are practical and can actually, do the kind of things that we may need to do? What would those look like? How would we run them and finance them and all those things? And so the idea of the book was just to try to put these different pieces together, the sort of normative underpinnings, the medical and sort of epidemiological work of when you have injustices, how does that harm health? And if you can work against those injustices, how will people's health be better? And then finally, just sort of the practical nuts and bolts of like, well, how do you actually run this from a public administration standpoint, from a financing and taxation standpoint, from, the goals of program administration and implementation, where can you go wrong and all those kind of things. And so that was ultimately the motivation, I think, was to kind of put together these different pieces in one book.
Right. Yeah. Well, I really appreciate it because, like I said, most people in your position won't take the time to do that, also aren't well equipped to do that. And I saw that you got that MPH, and I think that that kind of says a lot to your, like, you're trying to grasp these bigger
Mhm.
societal, economic reasons why we're in the situation we're in. My I have a personal interest in this. My sister died of basically alcoholism, liver failure
Mm.
2 years ago, and she was always in a situation where she could not access really good health care and like also psychological interventions because she wasn't well off and she was in a part of the country that was underserved. Like it's hugely expensive, right, to like deal with these things. And so if you don't have that access, it makes the difference between living and dying, literally. So
Mhm.
it was an extremely like frustrating thing to see and really know that there was only so much that we could possibly do without the support of basically the state. So I have personal experience with this situation, and I've seen so many other people struggling. And actually, in our part of the country here in the Midwest, even if you have decent health insurance, you may not have access to decent
Mhm.
health care too. So maybe we can talk about that. But I guess first of all, I mean, one of the things that leapt out from your book to me was this phrase, the economy is a government program. I agree with that. I always have. I've always been able to see the intersection between government policy and our economy and the ways that our government supports our economy. So maybe talk a little bit about that. What's your view of why is the economy seen as a government program?
Yeah, no, I think it's a great phrase and one I didn't coin. I think I got from a policy analyst named Matt Brunig. I mean, so the reason that I think that is the case is that if you think of, all the kind of market transactions and everything that we think of as sort of being the free market, right? The ability to contract and exchange goods and services, and sell your labor to get paid, and then use what you're paid to buy the things you need to leave and all that to live. If you're the owner of a factory or the owner of financial assets that get used in production, the ability to get a dividend or a rent payment or all these things from allowing them to be used in production and all that stuff. All of that is essentially backed up and only made possible by state power, right? I mean, so you have to have some system of regulation, organization, contract enforcement. We, use infrastructure like public roads and the internet, and the sort of shared heritage of knowledge and technology, and technological capability, and all these kind of things to do all of this. And, all of that, exists in the form that it actually exists in through state action, in some ways. And I think that's good. I think we benefit a lot from having market exchange and allocating, certain goods and services through the market and all these things. But, we have to acknowledge that markets have to be carefully tended and maintained. And if there's not the sort of active work of, making them function, they're not these kind of spontaneous things. And I think too often people, think of markets as being somehow apolitical, like they exist outside of the state, and the state just sort of comes in and imposes rules like taxes and things like that interfere with the workings of the market. But markets don't. They're creations of the state, of a system of rules and system of social relations and those kinds of things. And I think understanding that's really important because it lets us change the question not from should the government be involved or not, which is, it can only be answered in one way. Yes, the government has to be involved. There's no other alternative, to saying like, what is the best way to shape the regulation, shape these things to achieve particular ends, and what those goals should be. So I like that phrase a lot because I think it reframes are thinking away from like, oh, should the government get involved or not, to saying like, what is the best way to manage markets and the economy in order to achieve our normative goals.
Yeah. So like, let's talk about like how you see the economy now. In other words, what's the government program now? What's it supporting? And then we can talk about like what you would like it to support. But yeah, like how do you see it now, and how is the way it is managed now affecting people's health?
Yeah, so I mean, I think I think there are a number of ways that we sort of go wrong in how we manage things currently. I think there are a couple, you can maybe say three or four key areas. So one is I think we really overly tie income distribution to people's connection to sort of market production. So, if in sort of classical economic terms, you talk about the factors of production, land, labor, and capital, and people receive payments for supplying at least one of those factors of production. So if you work, you get a wage. If you, supply land that can be used, you get paid rent. If you supply capital, you get paid a dividend. And so all the income, the national income, the total amount of income that a country produces, can be distributed to those factor owners in some sense. And if that is your only income distributing institution, if the only way income gets distributed is by being one of these factor suppliers, you leave out a huge swath of the population, right? Because people can only engage in paid labor for a portion of their lifetime. Most people do not own, productive assets enough to live on. They don't have a trust fund. They don't own a factory that they inherited and all these things. And so if you're only distributing income to people on the basis of their relation to economic production, then you're missing a lot of people. And in fact, the numbers are pretty stark. So only about half of people in the US are actually engaged in paid labor at any given time. And that's not because people are lazy or they don't want to work anymore. It's for these very structural reasons. So 40% of the population in the US is either under the age of 18 or over the age of 65. So sort of times in people's lives that I think we all just sort of recognize these are not times that people should be primarily supporting themselves through engaging in paid labor. And then of the remaining, the 18 to 65-year-old group, which you might call sort of the working age population, about 10% of the total US population in that sliver either has a work limiting disability or is a full-time student, and so will be working later, but just isn't currently, or is unemployed and kind of temporarily in between jobs, but is looking for work, or is doing socially necessary but unpaid caregiving, like raising children or taking care of sick family members and things like that. So also all in situations that are completely socially necessary and are unavoidable, but are not currently receiving a sort of market income. And so if we don't have sort of income supports, transfer payments to people in these situations, they're really not going to have the income that they need. And so and all societies recognize this, and the US has, income support programs, as do many other countries, but ours are, I think, less developed and weaker. And so I think a major way our economy fails people currently is we overly tie income distribution to this connection to economic production, and we don't take sufficient account of the many times in people's lives, and this happens to everyone. We were all kids. If we live long enough, we'll all get to an age where we're not going to go out and work. And so if we're not providing support for people in these kinds of situations, then we're really missing a key opportunity for people to be healthy.
Right.
Sorry, I know I'm going on for a long time, but the one other thing I'll say, so that's sort of the side of people who are not engaged in production where I think the economy fails. The other side, though, is, all right, what about people who are engaged in production? And so here you really get a distinction, often between workers, employees, and then, sort of the owners and the managers of productive assets, whether that's a, factory owner in sort of the old classical industrial model, or, you and I in the service, sort of education and academia and service sectors and whatnot, we're still, employees, and there are, their bosses and, functionally owners. We're both at public universities. So maybe you could say the public is the owner in some sense, but we have boards of regents and, those kinds kinds of things. And so I think the economy is very much, so there's always going to be, to some extent, conflicting interests between these different parties just based on their different roles. And that's not to say the interests of one side always needs to take precedence over another side or anything like that. But you do, I think, need rules and regulations that try to balance power between the people in sort of more ownership positions and the people in more employee type positions. And right now in the U.S., I think that balance of power is out of balance, that things much more favor people on the ownership side. And so that leads to things like, inadequate income distribution, poor working conditions that people have limited ability to change, precarity in employment, and those kinds of things. And so, separate from the issue of needing to distribute income to people not connected to economic production, I think there's also this issue of what the balance of power between the various parties engaged in economic production is, and if our current rules and regulations kind of put their thumb on the scale a little bit in favor of some rather than others.
Hmm. Yeah, so before we move on to kind of your vision of what might correct this, I wanted to see if you could address a couple of different groups. One is the sort of inner city, like homeless and barely housed, transient and underhoused and underserved population. And then the other is kind of their twin in the rural areas where whether they're poor or not, but particularly if they're poor, they may not have hardly any access to healthcare or other decent services. In a lot of ways, I see them as really suffering from the same problems in a way. Where do you fit those types of groups into your equation?
Yeah, I mean, I think it fundamentally comes down to, what reasons people might be in for, for in these particular circumstances. So, say, and maybe this is stereotypical, but say you're thinking of a sort of urban homeless population. In general, you're going to see high prevalence of work-limiting disability in that population. Either physical disability or mental health issues or those kinds of things. You may see some unemployment where people are looking for jobs, but it's just difficult to get a job when you don't have a place to stay and other things like that. And you actually, see a lot of families that are unhoused as well, and frequently women who've left due to domestic violence situations and have their kids with them, but had to leave in a hurry and and may not have a lot with them and things like that. And so I think a lot of the roles that I was mentioning before, whether it's having a work-limiting disability or being a caregiver or being unemployed, I think feed into this sort of situation. And so I do think to some extent a key piece of the puzzle would be having income support programs, what you might call social insurance type programs that are tied to these situations people are in, whether that's disability income, whether that's income for caregivers, whether that's child benefits, like a child allowance or something to allow a parent to help take care of their kids, and those kinds of things. And so I think that could go a long way as well. In the rural area, I think what you often have is, I mean, the defining characteristic of rurality, I think, is just lower density than, urban areas, right? There are just fewer people in a given area. And so it's generally just harder to sustain the same level of services, the same amount of infrastructure, or to think about another way, it's more expensive to have sort of the same level of services and infrastructure to serve fewer people than more people, just because there tend to be economies of scale for these things. And so, you might have a small hospital that doesn't see, a lot of patients, can't keep up the volume in order to, have the staff that it needs, to have the expertise and care that it needs. It's trying to, just sort of do what it can and those kinds of things. So that's one piece. And so the issues that I think people run into, though, are exacerbated by some of these issues that I was thinking of in terms of, the imbalance of power between workers and owners in many cases, and so many people in rural areas, may be working, but for, less, with less earnings than in a different area. There may not be good paying jobs in the area. There may be less sort of economic activity overall. And so when people, don't have the sort of rules and regulations and things on their side that allow them to organize effectively and advocate for better paying jobs and amenities in the area and these kind of things, then you wind up with services that are essentially underinvested in and may not be able to kind of really meet people's needs and those kind of things.
Yeah, we have a lot of drug use, alcoholism in rural areas, and it seems like it, correlates. The more sort of depressed the area is, the lower the population, the worse those problems can be. And I sort of have a foot in both worlds. I go into Kansas City at least once a month to help out at the farm that I'm the JP2 farm that I'm associated with. And on my way there, like you mentioned, handicapped people. Along my way there, I see, seems like a lot of homeless people in wheelchairs, I don't know, how they make it at all, but they're literally, under overpasses or in the median in their wheelchair. And here in Manhattan, Kansas, we are sort of technically a rural area, even though we have a population of about 50,000. And we don't even have like decent access to healthcare. There's not enough doctors. And then if you go further west, it gets really bad. If you need any medical care, you're going to have to be life flighted somewhere. So to a certain extent, the problems are different, and yet we've got these, but there's some overlap, and we've got these populations that just are kind of in limbo, and the government isn't muscular enough in this area to be able to really handle their problems, because partly in the medical sphere, our medical system is still largely, I guess, private. I mean, it's got a lot of government funding and backing in some areas, but not enough direction to basically say, no, these services need to be here and they need to be supplied to people who can't afford them. So I guess that leads us to the issue of kind of where you would like us to go. And I suppose we have to factor in where we are now, like as far as politically, but let's talk first about just, what your vision of a better system would look like. First, maybe address like the fact that we now have, the Affordable Care Act, and maybe speak to that. My sister, used to complain about the Affordable Care Act because it still wasn't very affordable for her, and it didn't help her to get a quality medical care, actually. So, yeah, like what about that? And then maybe talk about like what might replace something like that in your scheme.
Sure, yeah, and I do think it is helpful to think about what we should aim for and know what our goals are, even which is a separate question from how do we get there, or even how likely are we to get there. I mean, those are real practical issues that we need to pay attention to. But I think if you don't have a sense of what you're aiming for, then it can be hard to know, all right, well, what's the next step to get you there, even though you might have to, compromise, given the real situation. So I do think there's utility in that.
Yeah.
I understand your question is sort of focusing on the healthcare side, and so I'll talk about that. But before I do, I'll just preface that by saying, I think you would probably expect a doctor to say, well, healthcare is like the main reason that we have, poor health equity and poor population health in the U.S. and sort of our bad approach to healthcare. And I definitely think there's a lot we could improve about our approach to healthcare, but I actually don't think healthcare is sort of the main explanation. I think a lot of other things, in particular, the way we distribute income and, opportunities for good jobs and those kind of things are probably more important overall. But healthcare is very important. And so I do want to talk about that. So the way I think about it is this: I think it's helpful to separate what you might call the financing of healthcare and the production of healthcare. So the financing aspect is sort of, what goes into to pay the people to produce healthcare, the doctors, the nurses, the people building hospital, all the things that go in to that, and then there's the actual how do you organize the production of healthcare? How do you run a healthcare system? How do you run a doctor's office? And those kinds of things. The on the financing side, I think you kind of have sort of, I mean, so on one hand, you could say there are kind of two options. You have a sort of privately financed option or a publicly financed option. Fundamentally, though, even in the US, virtually all healthcare is publicly financed, and in most other countries of the world, like almost all healthcare is financed. So, I mean, in the US, even if you only, which we often tout as having a private healthcare system, when you add up the number of people covered by Medicare, which is government financing, by Medicaid, which is government financing, in the VA system for people out of the military, and the TRICARE military healthcare system for people currently in the military, the Indian Health Service, people getting, marketplace plans through the ACA, and even people for private insurance. We think of that as being private employer-sponsored insurance, but that's heavily subsidized by the fact that the employer contribution to those premiums is not counted as taxable income. So what your employer pays on your behalf for health insurance, if you have employer-sponsored health insurance, doesn't go into your income tax base and thus is not taxed. And so depending on what your marginal tax rate is, that might be a 30-ish% subsidy that the government is essentially paying for your health insurance. So really, the government has its hand in some sense in financing all of healthcare, but we do it in this very fragmented way. I just listed off 5 or 6 or 7 different ways that people can get healthcare, even though the government's involved in all of them. And so one question is just like, well, couldn't we just simplify this and say we know the government's involved in all of it? Like, can't we just have sort of a single system of finance for this that kind of covers everyone? The second side, though, is the production question. And so here there's another sort of public versus private question. So you might think of like the British National Health Service, where at least on the inpatient and hospitalization side, the doctors in the hospitals are government employees. They're run by the government. That's who organizes it. Whereas other types of systems like the US, but also like Canada and other systems that we think of being well performing, still have private producers. So healthcare is financed publicly. So in the Canadian system, which is also called Medicare, like the US system, but covers everyone, the financing is public, but the hospitals are still, or can be, private entities, and doctors can be private entities, and those kinds of things. So the production side can be public or private as well, and so it's actually not always the case that public finance equals public production of healthcare. There can be those kinds of differences. I think the argument for public finance of healthcare is essentially inarguable, and is essentially the same argument you would make for public finance of basic education, which we accept for everyone, which is just, this is just a service that everyone needs. There will be times in people's lives because of poor health or just because of age-related or sort of normal life course reasons that you can't go out and earn an income and buy this. And so it just makes sense in sort of an insurance-like sense to pool your resources and finance it publicly. So I think there's a very overwhelming case for sort of a single public finance mechanism for healthcare. I think things are more difficult, and I don't think there's an overwhelming case for one approach versus the other in terms of production of healthcare, whether it's public production, a sort of national health system approach where all hospitals and doctors are government employees, or a public insurer type approach where the government is paying, but they're paying private producers. Both different countries, a number of different countries have put both approaches into practice, and they work fine. They have, and I go into this in a little more detail in the book, but so they have sort of predictable issues that arise with either a public production or a private production approach, but they also have predictable benefits that arise, and you can essentially, I think, make either work in a morally defensible way and sort of provide a good level of healthcare to everyone through either approach. In the US right now, just because our system is so much based on private production, it is sort of hard to think that we would transition very quickly into a public production approach, although there are good examples. The VA health system in the US actually provides very good quality care that's fully public, both finance and production. So there are examples to draw on, but overall, I think in the US we likely would maintain some type of private production, and so then I think our efforts might be more towards moving to sort of a mechanism of public finance, just to ensure that everyone has coverage, whatever stage of life they're in. It's not tied to losing, having a particular job that you can then lose, or getting sick and not being able to work, and then you don't have health insurance at the time that you need it most, and like all the issues that come up all the time in the US.
Right. Yeah, for sure. I went to Canada once and I was surprised to find that visitors are also treated just like their citizens. I had a problem and I just went to a clinic, got the help I needed.
Yep.
It was amazing. Um, so let's talk about where you want to go more broadly then, because yes, your book is, one message that you're trying to convey, I think, is that it isn't just about this narrow, the narrow question of the healthcare system, but that in order to make this society more is beneficial for everybody, that we really do need a different system, both sort of politically and economically. So, like, you advocate for what you call social democracy, and so talk a little bit about what that means to you, and maybe if there are some examples out there in the world that you admire.
Yeah. So I think of social democracy and I'll say, like many terms, different people use it in different ways. I think I'm broadly using it within a spirit in which other people use it, but I might not be using it exactly the way that everyone else uses it. So I think of social democracy as bringing democratic, by which I mean sort of egalitarian and not hierarchical relationships to the key sites of human cooperation, which I view as sort of civil society, politics and government and economic relations. And so the idea of social democracy is that you have, egalitarian democratic relationships in all of these different spheres of life. I think on the civil and political side, at least formally, I think that's pretty broadly accepted. So I think, because of egalitarian social movements like the civil rights movement, like the women's suffrage movement and things like that, I think we in general accept that, you shouldn't be able to deny people the ability to stay in a hotel because of their race or ethnicity, or you shouldn't be able to say who gets married because of their sexual orientation, or you shouldn't be able to say who gets to vote or run for office based on their gender or those kinds of things. Substantively, I completely recognize that that doesn't always hold true. I think there absolutely is still discrimination that happens. I think people's, lives are patterned by systems of oppression. And so I by no means am saying, because we passed these laws, all these problems went away. But I think if you ask most people really across the political spectrum, you don't get a lot of disagreement with the idea that some of these civil and political rights should be equal. Excuse me. On the economic side, I think there's a little more controversy there. I think, again, sort of getting back to some of these, power relationship issues we were talking about earlier. I think people are in general a little more okay with hierarchical relationships in the economic sphere. Anyway, so I think there's probably a little more work to do there. But fundamentally, what I'm thinking of in terms of social democracy is the idea that there are egalitarian relationships across all these different spheres. And I think there actually have been a lot of movements and times when social democratic politics have succeeded and been successful. An example that I think comes to people's mind a lot right now in our current time are some of the Nordic social democracies. So Finland, Norway, for a time, Sweden, that was really, for most of at least the second half of the 20th century, that was probably the main example. They subsequently have had, a lot of sort of political backsliding, and it's sort of questionable as to how egalitarian Swedish society really is right now. But anyway, so those are some of the examples that come to mind. And then that brings up the idea, well, that maybe that works there, but it doesn't work here. But I actually think there have been, social democratic politics in the US that have been very successful. I think you can view the sort of New Deal era in the US as essentially a social democratic movement that really brought a good degree of egalitarianism into the economic sphere. I think you can, certainly you can see the civil rights movement and other things in the 50s and 60s in the US is sort of bringing social democratic ideals into different spheres. And so I think there are real examples both in US history and then in other countries contemporaneously that really show the possibility and practicality of this. It's not just sort of a pipe dream that can never happen. It has happened in the US. It is happening in other places. And so I think, certainly can be done.
Hmm. So, and in these examples, capitalism still exists, right?
Yeah.
Simply, there's a lot more redistribution in favor of the majority of people. right?
Yeah, so 100%, all so I think of the distinction between capitalism and socialism as, sort of an ownership of the means of production. So who owns the factories? Who owns the productive assets? All of these questions, though, are applicable whether you're in a capitalistic or socialistic economic system. You can have a socialistic system, and you can think of, Soviet Union or Eastern Bloc countries as ones where nominally these were government owned, but it wasn't democratic and it wasn't egalitarian, right? There was still these sort of hierarchies of, political elites, and then, a lot of people who were oppressed and disenfranchised. And so, this issue of equality is totally orthogonal, in my opinion, to the particular type of economic arrangement that you have. What policies and practices you need will look different in different systems, but it's 100% that the case that, the questions I'm talking about are ones that, or the changes that I'm talking about are ones that can be done within the context of a capitalist system. And the one, maybe this is my own sort of quirk or whatever, but I'll just call out because you talked about redistribution. A really key thing to my own thinking, at least, and stemming from this idea that we talked about earlier of the economy being a government program, is that essentially there is no redistribution. There's only distribution. So redistribution is this idea that, like, oh, it used to belong to someone else, but then the government came in and took it and gave it to someone who maybe didn't deserve it or something like that, because they had the political power to make them do it. But if you really kind of deeply, sink into this idea that the economy is a government program, then all of the way that, income and anything else gets distributed in that system is all just sort of part of the same system that you're in. And so it's not like the ownership rights existed outside of that system. And again, someone sort of imposed themselves and took it from other people. The rules of the system define what, ownership rights people have. And so the income that people receive through transfers and things like that is not being redistributed from one person to another. It's just being distributed to them, as part of the rules of the game. And so, sort of an example I use of this is, say you're going to work in a shoe store, and you agree to work for $20 an hour, and you work for 8 hours, and you get paid $160. And then in the course of that work that work day or something like that, you sell $860 worth of shoes or something. And so you get 160, and then you leave in the cash register at the end of the day the other $700, and that gets allocated to the owners of the store and all that stuff. You're not redistributing it wasn't your $860 to begin with, and then you redistributed 700 of that to the owners. The what you agreed to at the get-go was, you're going to get paid the $20 an hour that you worked. The owners are going to keep the receipts, and these kinds of things. And these are just sort of the rules that we're in. And that is the same way that any of our, when we think about paying taxes or transfer programs like Social Security checks or all the things, that's how all that works. There's some set of national income that is generated in a given time period, and then it's distributed according to particular rules. But that distribution just is the distribution. It didn't start out one way and then go and be redistributed to something else. So anyway.
Yeah, for sure. So what would you say? I have a theory that if we could, if I could just wave a magic wand and suddenly we're in this democratic socialist context and people are being taken care of and there's a much broader, just a sense of security and well-being. And yet, capitalists can still kind of function in this system and still maybe make a little bit more money than the other, than other people, that actually everybody would probably be happy with it. But it's the getting there that is the problem, because all along the way, especially in a country as contentious as the United States, everybody's trying to figure out, like, how's this going to benefit me? How's this going to hurt me for the next month or year, not, what my children's future or anything like that. And so we don't seem to be able to even have that, dialogue here. Like in other countries, people can seem to have that conversation and maybe at least contemplate it. Whereas here, like, people get very afraid that somehow, whether the owners of capital or whether they're the wage workers or non-wage laborers, they're worried about their position immediately and think that whatever we're proposing is going to make things worse, and they dig in. So, like, how do you, I mean, obviously you're on these podcasts because you actually think that you want to get your ideas out there right into the public sphere. So you're trying to do this, but like, how do you say, for instance, to the business owner, you should pay more taxes, and here's why. What's the argument?
Yeah, well, I mean, I mean, I think your comment before hit it exactly right. I mean, the goal of the book and the goal of explaining these ideas and things like that is just that, to make this kind of case. And I mean, I think if you think about, what can, I'm an academic. I know you are as well. What can an academic do? What is the real role? The role, I think, is to try to understand and synthesize and explain things. And so I do think the start of all of this, and by no means is this the only step, but the start of all of this is, having an understanding of what we should aim for, having an understanding of why we should arrange our social policy in particular ways and not other ways, and those kind of things. And so I do think and maybe this is just, my own self-delusion, but I mean, I do think there's work to be done there in terms of trying to marshal this argument, to lay it out, to try to explain it to people, and those kind of things. And so that's what we're trying to do here. There's 100% additional work that needs to be done in terms of organizing and, actually, building and wielding power, political power, in order to put policies in practice and sort of change the material conditions that people are in. So, it's not that the only step of the process is understanding and explaining, but I do think, if you don't have some sense of what to aim for and why you should be working for it, then, it's hard to get started as well. So there's value there. In terms of the sort of particular conversation with, say, a business owner or those kind of things, I mean, I think again, the premise of the book, and I think it's a simple premise that, at least in the abstract, most people accept, although it has some implications that take a while to work through, is just that, we all have a fundamental moral equality. We're all at some moral level fundamentally equal, and the job of democratic government, the reason that a government can legitimately have power over people's lives is because it shows them equal care. That's where the title of the book comes from, that the justification for a government having sovereignty over any individual's life is that it treats that individual equally with other people, that it cares equally for how that life goes. And if you accept, this just sort of fundamental moral equality, and then the idea that the purpose of government is to translate that moral equality into the material conditions that people live in, substantive equality, what I call in the book, following political philosophers, not my term, but relational equality and equality of social status or social standing. If you accept that is a goal, then I think almost everything else follows from that. The reason that we need to, have income support programs during times when people can't work is to ensure that, they have equal social standing and status during those periods. The reason that we need to balance power between, owners and employees is because we need to ensure that people have this sort of equality of social status. And so essentially everything stems from what I think is a fairly widely agreed upon principle, at least in the abstract, of just sort of the fundamental moral equality of individuals.
Yeah, actually, social democracy, some of my colleagues will tell me, like, when I advocate for social democracy, they want me to be a purist, and nothing but the beloved community or some sort of actual socialism will do. But actually, I feel like if we could ever get to the point that you're talking about, which is a doable prospect that other countries, as you pointed out, have achieved at least quite a bit. We would be living in such a better situation than we are now. But I mean, honestly, it's a compromise with the ultimate, beloved community, or the ultimate socialist situation. And that's my interest in speaking to Christianity is partly due to that, because the ultimate vision in Christianity and a lot of other religions is the beloved community, where people actually do see each other as moral equals and as valuable with human dignity in their own right. They take care of each other, right? And we are so far from that, that the next best thing is definitely democratic socialism, where you start to you may back into the system at, at a certain point because society has to, or because somehow you galvanize enough coalitions to do it. And then hopefully that creates over time even more like regard for other people's welfare and a consciousness that your fate is tied up with the overall well-being of the society, right? And that you can't really like hive yourself off no matter how wealthy you are or what your situation is. But like one of the issues that's lingering in my head here is, of course, and everybody else's, is that we just had an election, and it was, fairly dramatic, like mandate for the Republican Party and for the Trump, the Trump version of it. And I mean, this is actually an honest question. Do you think that our society is right now more ripe for change? Or not, or less ripe for change as a result of what we just saw happen in this last election?
I actually do think we're more ripe for change. So I mean I agree with you. I think it was a pretty decisive result. Definitely no election denialism or anything like that going on. With that said, it was 51, 52% of the electorate, and an electorate that's like a third of the total population. And so it is it like this sort of overwhelming mandate that everyone in the U.S. agrees with every aspect of this? I don't think so. But I mean, definitely according to the rules of our political system, there's going to be a change of power, and that's what the will of the voters was. I do think the overall trajectory from at least 2008 on has been this sort of fracturing of a kind of census technocratic liberalism idea that it essentially ruled from roughly the 60s to probably maybe through the Obama administration or something like that, where there was clearly, Democratic Republican divide, left right differences and whatnot, but fundamentally, I mean, I think more or less we saw a coming together of Democratic and Republican policy positions during that time period towards, sometimes people refer to this as neoliberalism or other things like that, but just sort of a centrist management technocratic focus on governments and social policy and those kinds of things. I think that is fracturing, and I mean I think the questions that are being asked are which way does it go? Does it go in a more right wing or more left wing direction? I think you can see the Biden administration as maybe a reprieve to some extent, a bit of a throwback to Obama and Clinton and that sort of middle way or third way Democrat, and in other countries the sort of Blair government in the UK and that kind of thing. Macron, I think to some extent in France is sort of a thing as that as well. And so there was an argument with Biden coming in that like, well, maybe the fracturing of sort of liberal centrism was overstated to some extent, but I do think this result and the decisiveness of it is kind of really saying like, nope, that way is not going to hold. It's not galvanizing to enough people to really be politically viable. And so I think you're gonna have a couple options. I think you're going to have the more Trumpist option and the policies that are there, or I think you're going to have a more social democratic option. But I think something is going to have to replace the sort of centrism that we saw for essentially most of my lifespan. I was born in 1981, and so I mean you could mark. People debate whether Carter or Reagan was sort of the first of the neoliberalism, but somewhere around roughly 1980 on, I think that's sort of been what the consensus frame of governance was, and I do think that's fracturing.
Yeah, I think the fracture is probably going to make the society more open to solutions outside of that framework. I would totally agree. Even though right now perhaps that's, I mean, who knows how that's actually going to gel this current, the current decision, how that's going to play out. But there is a rejection of that consensus. I agree. And one of the things that I've heard from the people that are, for just as an example, that are like that did support Trump, is that they're tired of all these endless wars, which I know is outside of your topic, but they seem genuinely tired of all of the international involvement. They're not particularly pro corporate power either, and I think that people are sort of at a gut level, they're sort of protesting the status quo here.
Hmm.
So among the messages we could get from this is that, if you came with like decent ideas and a program, which is what they were asking for from the Democrats, that, that you might stand a chance of being heard, and so. And in the past, the democratic socialist argument has really not been allowed in our society to be heard because the Democrats didn't want to hear it.
Yeah,
Um,
no, I think that's totally right. And I mean, I think we're all still sort of processing the election, and maybe other opinions or my opinions, everything will change. But I think your neighbor in Kansas to the east with Missouri had this very interesting election result where was strongly Trump, strongly reelected Hawley as senator, but also put in place abortion protections and also put in place a minimum wage increase through ballot initiatives that were sort of outside of any voting for any particular political candidate. And so you do see this kind of two different poles, neither of which are sort of again this sort of centrist or sort of consensus frame, but generating significant enough support to win on both of the directions in which it could sort of fracture in. And so I think that's just sort of an interesting metaphor for what might be happening more broadly. And I totally agree with your point that I think there may just be more possibility for positions that were kind of more marginalized in the mainstream through a lot of the previous decades.
Mhm. Yeah, it may take a while, but I think we're going to have a different conversation moving forward. Um, so, one thing I always like to ask, and I have the time, hopefully you have the time.
Yeah, no.
Okay, so like you know that the Morin Academy in this channel covers a lot of environmental and just agricultural news too, ideas. And I know that this isn't in your book, but you say towards the end of your book that you acknowledge, right, that you didn't have time to deal with the environmental issues that we face, but they are like they do impact health as well, and they are wrapped up with our political system and our economic system, and food related issues are a big part of our the how we handle food is a big part of our environmental
Yeah.
footprint and problem. As a doctor and as an author of this book, what do you have to say about our current approach to our food system and and the environment more generally, and how it impacts our health and well-being, and how would you see that issue fitting into your vision of a better future?
Yeah, no, I mean, so the food piece in particular is sort of a near issue to me. I don't really talk about this in the book, but actually my day-to-day research is on issues like food insecurity and diet and nutrition and what's sometimes called food as medicine, sort of the use of nutrition programs to improve health in various conditions like diabetes or heart disease or kidney disease. And so, I absolutely think that the our food system contributes to poor health. We are really geared to and subsidize the production of inputs to processed foods, refined carbohydrates, foods that are high in sodium, and those kinds of things. And that's probably not health promoting. It's definitely not health promoting that those things, because of the way we subsidize it and, sort of economy of scale and other things, that those are cheaper than foods you might consider healthier, less processed food, more produce, fruits and vegetables, lean proteins, unrefined carbohydrates, those kinds of things. So that has a real impact on population health. We make a lot of completely admittedly tasty, but probably not that helpful calories available in ways that just don't mesh well with the human organism and human biology, and so we see a lot of consequences from that. And at the same time, the types of production and sort of large scale production that allows for that also has huge environmental impacts, and I think that's really important as well. So I do think there's a lot there. At the same time, the reason that a lot of this happens is economic, right? I mean, so the um, you know you can think of this sort of, cartoon villain who loves polluting just because they love polluting, but really people love polluting because it's a cheaper way to make money, right? It's you can make more in ways that pollute than in ways that don't, and those kind of things. And so I mean I think the way the you could use what is in the book to think about this topic, although it definitely was not in the book for the reasons you say. I had to draw the line somewhere basically and not make it 700 pages and completely inaccessible. Is to think about, well, how do you handle these problems where there are these kind of, competing demands and trade-offs? There's the need to improve population health and make healthy food affordable for everybody. There's also the need for some economic production and generating income that people can, use to live on and things like that. And fundamentally, I think the way to handle these trade-offs is democratically. And I think a lot of the problems that we have now is because we have these concentrations of power. I think the large concentrations of wealth essentially mean large concentrations of political power. You get regulations that are in favor of, certain types of food systems and not in favor of other types of food systems. And so I do think a more democratic and egalitarian approach would let people solve these kinds of problems more productively. Doesn't mean there won't be trade-offs, and doesn't mean that there's going to be a perfect solution that necessarily emerges from that. But I think putting the different stakeholders in relationships of equality of each other and not the sort of hierarchical relationships that we have now would be a more productive way to get to some of the solutions for these tough problems.
Right. I was thinking about your statement towards the beginning about how government, so it's sort of like the author of our economy, right?
Mhm.
Like it always will be. And so it's a question of what system, what does government want to support? Right now, we support big agricultural systems, right? And with a lot of money and a lot of programs. Um, and I have, been like this, I don't know, voice in the wilderness, basically saying, if you just take some of that support and you shifted it to local and regional agriculture and you supported more healthy options for instance, school lunches and all the various programs that we do run to supplement people's nutrition. And if you did that, we could have a system like that. It is a matter of money, and our current farming system is subsidized. We could subsidize a different type of
Right.
system and be a lot healthier.
Yeah.
Uh,
No,
yeah,
that's exactly right. I mean, I think one way to think about what markets do and why they're useful is that they optimize in a way that's difficult to do through planning, right? So when you have a lot of different trade-offs and a lot of different people have different preferences and all these things, it's hard to know, well, how do I make the exact allocation of goods that people are going to want and drive increase in quality and whatnot? I say, well, don't worry about it. Set up a market, and then just the market will respond to various consumer signals and it'll do these things, whatnot. And so that's the good side of markets. But what gets left out of that equation is markets will optimize for any given set of background conditions, whatever constraints you give it. The idea, at least in theory, not saying this always happens in practice, but at least in theory, is that the market is going to sort of find the optimal solution for that set of background constraints. But it doesn't tell you anything about what that set of background constraints should be. That set of background constraints has to be set normatively, I mean, based on other goals. And so just as you say, right now, if the only goal you give it is, make as much money as possible and don't care at all about environmental degradation or the distribution or anything like that, then it will optimize, in that set of rules in a particular way. But if you change the rules a little bit and say, all right, feed everyone, but also, limit greenhouse gas production to a certain amount and limit production of XYZ harmful chemical, below a certain threshold, and don't use this kind of scarce input and that kind of thing. The market will still find an optimal solution under those different background constraints, right? I mean, that's still is the beauty of it. And so it's completely possible, I think, to marry the approach that many people in the US like so much, which is to use these sort of market-based solutions to the sort of normative goals that I think we share of making sure that everyone has substantive relational equality. And so it's just a question of sort of setting up the conditions for the markets to run, as opposed to just saying like, well, the market wants this and that kind of thing. The market will will operate in whatever set of background constraints you set for it.
Right. Yeah, I agree. Yeah. And yes, those things are a little bit more expensive. And yes, we could provide some government aid to make them possible anyway.
Yeah.
Yeah, it's probably about time for us to wrap up, but was there anything else that you wanted to talk about that we didn't get to?
No, no, it was a great conversation, and thanks again for having me on.
Yeah, thank you. Hope to have you back.
Yeah, it'd be great anytime.
Cool. Okay, I'm gonna stop the recording.
All right.